Hey, good morning. Welcome to the VCU Paramedic Program Clinical Training Series. Right now, what I'm going to go over for you is the Clinical Internship Grading Rubric. This is what is expected for you to have completed, turned in for every clinical shift that you work. I gave you guys all of this form here that you see, the Clinical Internship Grading Rubric, and that pretty much tells you exactly what the expectations are for each shift. Remember, this is for each shift, and you must have a minimum of 6 shifts per semester. They include the daily performance evaluation, your clinical journal, your assessments. How many assessments? If you said 10, you are absolutely correct. That's a minimum in the emergency department. Everywhere else, we take into account unit census and what your availability was, as far as how many calls you were able to run. You need to document all that kind of stuff. Paperwork completeness, you're going to get some points for that. That means, did you turn everything that is required in? And also your PCR or D chart, which is our narrative. Let's go over a couple of them really quick. Again, the daily performance evaluation, that is this form right here. Every single shift you run needs to have this form attached to your FISDAP report for that day. This has 2 sides, so make sure you copy or scan with your phone, however you do it, both sides and attach it as an attachment. There's 9 places there for your preceptor to illustrate how you did that day. If they want to make any comments, they can make some comments. Make sure, this is where you get the signature proving that you were there. Make sure that they sign and date this, okay? At the bottom of the page there is a place for you to chart or document on paper for your preceptor to see and to validate how many assessments you performed, or if you're in the field, how many team leads, as well as what skills that you did. I only really care about these 4 skills as far as your preceptor signing off on them. Alright, hopefully that makes some sense. We did go over that, but this is a requirement for every single shift. Make sure that you have it, please. Second, clinical journal. Some of you have already started in the clinical environment, and I don't think we are quite understanding where this is at, so I'm going to show you really quickly on FISDAP. If you go to your skills and patient care section, your clinical journal is going to be in the comment box. That is this little bubble here, this little comment box. This clinical journal, you click on this comment box and it's going to bring up another add a comment text box. And this is where you're going to tell me, A, where you wrote your PCR narratives, like patient 1 and patient 4. You also need to tell me what you learned during the shift, what you're working on. Give me a little review, synopsis of how the shift went. This is supposed to be reflective in nature, illustrating what you learned. I have a student I'll pull up here, and I'll just show you one of his clinical journals. It doesn't have to be this long. However, his clinical journal is very good. If you'll notice down there, I did grade this shift, and he did very well. But if you look here, he kind of talked about, what he did during the shift, what he learned. He talked a little bit about the fact that he learned pre-hospital care of people who have seizures versus in the hospital, and some of their past. So he just reflected on his shift and what he learned, maybe what he could do better. That's very, very important. So let's go back to number of assessments. Where do we put the assessments in? How many assessments? Again, in the clinical environment, in the hospital, you need 10 minimum, meaning primarily in the emergency departments, pediatric and adult. If there, for some reason, is not enough patients to get 10, which in the adult emergency department will never happen, you need to let me know, and your preceptor can sign off in the preceptor comments. So if you're in the pediatric ED overnight and you only had 7 children come in, I do expect that you have documented or seen at least all 7 children. That shouldn't be very difficult, especially because we don't really focus on skills in the pediatric area, more on assessments. And as a caveat to that, I will say make sure that when you are in the pediatric area, you are looking for pediatric respiratory difficulty or breathing problems. That is generally an area where students come up at the end short. They are, for some reason, that is the #1 complaint for children, and yet often that's the one thing that we come up short with at the end when we're looking at our graduation requirements report. You need a total of 8 by the end of your program. So, assessments. In the emergency department, assessments can be self-directed. You don't have to follow around your preceptor to do all of your assessments. Certainly you may or may not be assigned to a specific person to be your preceptor, and that person could either be a paramedic or medic, or it can be a nurse. With that said, you check in with them. That's what you do. I mean, you follow them to a certain extent, checking in with them if you got to go off the unit, let them know where you're at. But by and large, you can kind of make your way around the emergency department, especially after your second or third shift. You should have a good swing of how things should roll. And at that point, you should be out there looking for learning opportunities, looking for IVs, looking for EJs if you can. Look for traumas. When the trauma bay has an alert, go that direction. Just let your preceptor know what you're doing. They ain't going to have a problem with that. I do want you to be able to walk in a patient's room and say, introduce yourself. Hey, I'm a paramedic student. I'm here to ask a couple questions, do a quick assessment. Would you have a problem with me doing that at this time? By and large, our patient population are not going to have a problem with that. They might say, another time I have to answer these questions, but really, when in fact I know from personal experience, they really like to talk about these type of things. Paperwork completeness. This is an easy section. This means that you did everything I asked, and you get 2 points for each thing that I asked you to do, and it was done correctly. Easy points. Back to the assessments, though. I will say, where do you put the assessments in? What is expected for an assessment? Let me go back to this area here. Let's go back to skills and patient care. And you see up here we have a whole bunch of shifts. You want to click on the shift you're going to complete your assessments on and put in the forms. And BizDap can be slow at times. Here is where it shows, this is where you add your patient assessments. So remember, you need 10 patient assessments, but you only need how many D-Chart full PCR narratives? In the hospital, you only need 2. In the field, we do every one of them. By and large, that reason being that we usually have enough time in between calls. We're training you to do and be paramedics. And when you're in the field and you're a paramedic, you're expected to write a narrative on every single patient. So you need to get in that habit. In the hospital, I want you to give me good narratives, at least 2 of them. And you need to make sure you're doing at least 10 assessments. To add a patient assessment, you come over here, you click on this plus patient sign. And here, you are going to make sure that you do, I performed this patient interview. Make sure that box is there. And you also perform the patient exam. Make sure that box is checked. That's the only way you're going to get credit for doing this in your graduation requirements report. Put in the patient's age. I can't tell you how many times people forget this and they don't get credit for their lifespan development portion of it. This is a male. Let's say ethnicity is not required. You can put it in there. It's fine. Let's say this patient was having a breathing problem. Okay, if they are having a breathing or airway problem and you managed in some way that airway, that could mean something as simple as giving an albuterol treatment. Click this button here. If that patient did not expire, you probably successfully managed that patient's airway. So just click this button here. Come down. Is that patient alert and oriented? I'd sure like to know. Yes. And give your primary impression. Try to stay away from other medical I do not want you guys to use other medical for any reason, because that doesn't give you an impression. That just says, I don't know. It's something in the medical field. That tells me nothing and really doesn't work towards your graduation requirements report. So in this patient, we were probably thinking something along the lines of respiratory. So let's click respiratory. Did he have another complaint, or are you worried about something else? You know what? Respiratory system and the cardiac system are pretty close. Let's say this guy had COPD. So I'm going to put cardiac. Was this guy, what was his urgency? I'm going to say he's a yellow because he's having some kind of breathing problem, but he was alert and oriented. Come down here. This is where you're going to put in your vital signs. Click here. If anything that you did, if you put in a nasal cannula, had to use CPAP on this patient, you're going to put it under airway. Cardiac, if you did an EKG on that patient, put that in here. If you did venous access, any meds, that albuterol treatment that we gave him, make sure, again, any one of these things, you've got to click this box that says, I performed this treatment. Medication, albuterol. And then dose, well, it's going to be 3 ml, and the route will be, let's see here, nebulized. And then click save. Let's see here if I can make this thing work. Very good. And then it'll say there, just make sure that this box says that you performed this intervention. If you performed it, if you observed it and you want to chart that you observed something, that's fine. Just don't push I performed button. But by and large, you probably performed this technique or this skill if you're documenting it. So please accurately identify when you performed or did not perform. Down here in this box, which my face is covering up a little bit, it's next, it says narrative next to it. This is where you put your D-chart narrative. I told you guys very well how to write a D-chart narrative. I will cover this in another section or another video, but you guys need to put your D-chart narrative on how many patients? If you said 2, you are absolutely correct. 2 in the hospital, and a minimum of all of them, I guess, if you're out in the field. So, D-chart writing narrative here. This is an exercise in critical thinking. So, this is supposed to draw or build me the picture of what you did or what you saw, what you worked on with this patient, and how you came to a diagnosis or a conclusion in the end. If you have more questions, watch the other video that tells you about writing a D-chart narrative. Please do it before your first shift if you have any questions, because if you don't have very many shifts for me to grade, I'm going to be grading all of them. With that said, I do understand you're learning on your first one. Just what I'd like you to do is when you're out there in the emergency department for your first shift, get the lay of the land quickly and just start. Be self-motivated. Find learning opportunities yourself, okay? Very important. Back to this, you need to look over this. This is how I'm grading you. Every shift is worth a total of 100 points. Remember that under the assessments column, if you get more assessments than 10, that's extra credit. I want you guys to strive for 15. We used to have 15 as a minimum requirement. With that said, I don't want you solely focused on only assessments. I can do 10 assessments in less than 2 hours. You're there for 8. What I would like you to do is get a good mix. Find some time to go work on your skills. Grab assessments. This is a learning opportunity. You're there for 8 hours. Even if the emergency department is not crazy busy, there's still always patients in rooms. Please just walk around, let your preceptor know that you're going to go do your assessments. I've told almost everyone who works in the emergency department that you guys need 10 assessments. They understand that. They also know that you need to get this form filled out. So make sure that they do that at the end, and then you upload it. The last thing I will say, and we'll close this out, is make sure that you get that form filled out before you do anything by yourself. What do you need? The only 2 things that you can do by yourself is IV sticks and phlebotomy, and you need to have those forms filled out that say that they have checked you off.